If you catching yourself feeling tired sometimes and you're thinking that you're just getting older, then you can find yourself trying to get an extra cup of coffee or taking more vitamins or doing all the things, right? But it still doesn't work. Maybe it's not something that you think it is. We keep chasing symptoms. And today, I would like for you to think about flipping the conversation into finding the root cause of why is it that we feel tired sometimes. Today, we have Miss Margaret Stoch. She is a mother, a wife, and a speech pathologist. She's an entrepreneur, and sometimes I don't know how she can do it all, but we are so lucky to have her here today. Margaret, thank you so much for being here.
Thank you so much for having me, Rosa. It's a pleasure.
So I know that you came from Poland, right? 25 years ago, but then you have been, in this business for like 14 years. So tell me, how did it all start?
Yeah, so I came to the United States when I was 16 years old, and I came with a dream of being a journalist. So after I finished high school, I studied print journalism and communication. And when I graduated, I found myself having difficulty finding work. And so I ended up working as a graphic designer at a print shop downtown in the city, Chicago. And I just working there for about a year and a half, figured that like a corporate job was not for me. So I searched for doing something else. And at that time, I already had my first son, and he was about 2 years old. And I talked to my sister. She was going to school to be a physical therapist at that time. And she suggested I look into this speech pathology program. So I did, and then kind of checked that out and decided to go back to school and got my second bachelor's and my master's degree. And here I am 14 years later.
Wow. So there was a lot of work, and you took the courage. I mean, like I haven't really heard much about speech pathology, right? And you are in a very specific field. So tell me, like, what's the difference? I know dentist, I know there's some orthodontist, right? So how about, what's the difference between what you do and other people in the field?
So speech pathology as a field is a pretty broad field of what kind of goes into the scope of a speech pathologist. We can work in early intervention, working with kids that are, birth to 3 years old. We work in schools, we work in a hospital setting, work in nursing home settings. So there's a lot of different things that we could do, not just working on the speech, but also working on language, cognitive, and then also feeding and swallowing disorders fall within the scope of a speech pathologist. So when I graduated, my kind of passion was in the kind of niche of feeding and swallowing. I started my career working in the hospital setting, working with head and neck cancer patients that had difficulty swallowing. Also, people that had strokes or brain injuries that had, speech and swallowing problems post their injuries. So that kind of how I started in that niche, and then I started working with kids, and then working with babies, and that was kind of the progression. But then when I had my own kids and they started having some difficulties that I couldn't kind of pinpoint of what was going on, I discovered myofunctional therapy and the world of tongue ties and lip ties, and that led me to kind of go down this rabbit hole of discovering Airway and everything that had to do with sleep and how all that relates to mouth dysfunction. And so now I like to call myself not just a speech pathologist, but also a myofunctional therapist and a feeding specialist. And I work with patients of all ages, including infants all the way through adults.
So what I gather is that you work with the people who have some illness, right? Or people that are just like seems to be normal, but then they feel tired or they have some problems with their, airway, right? So you think about it. So the way that I'm not a specialist like you are, but this is what I'm thinking. We have only one mouth. We have one tongue. So if something is, going on there, not the way it's supposed to be, then it affects us, right? Because this is where we, number one, we eat this way, right? Airway is important, and then we communicate, right? So to me, it's a very important area that sometimes we don't pay attention to. Am I correct?
Many times we don't pay attention to. And when it comes to obvious things, let's say, somebody who has an oral cancer, it's an obvious thing that they're aware that there's a problem that needs to be addressed. But otherwise, unless you had an injury, had an accident, have something that you're aware of, you're not aware of how your mouth functions and how it's supposed to function. So I like to explain it in a way that, let's say you broke your leg in a skiing accident, right? And now maybe you had to have surgery, or it's now in a cast and you can't use it for 6 weeks, right? But you're home alone and there's this plate of cookies right there and you really want the cookie, right? You're going to figure out how to get there. So you are going to use compensations. Maybe you're going to use some crutches, maybe you're going to crawl there, right? But you're going to figure out how to do it because you have that innate desire for that cookie. And when you start using those compensations, you have this leg, you can't, put pressure on it for 6 weeks, and you use the crutches, you do other things, right? So now your shoulders are going to hurt. You're going to be using more of your upper body versus your legs. Your leg muscles are going to now going into atrophy versus your upper body is going to be more tight. So those are compensations, right? When it comes to the mouth, what happens is most people that have mouth disorder or myofunctional disorder are born with it, and it starts in infancy, so they don't know any different. When you break a leg, you know what it felt like to have a functional leg. In this case, you don't know what it is like to be otherwise than what you are. Does that make sense?
Yeah,
And
absolutely.
so most people are not even aware that there is an option to function in a different way, because over time we create these compensations because, number one, we want to live, right? So we're going to figure out how to breathe. If we can't breathe through the nose, we're going to compensate and breathe through the mouth. We want to eat because that is another innate desire, right? We have that internal motivation. And if for some reason we can't eat in the correct functional way, we're going to compensate. We're going to figure out how to make it work. And then same for speech and same for sleep and all these other things. Everything that we do as a human is a learned behavior, including breathing.
Amazing. I didn't know that, including breathing. Sometimes we take things for granted, right? So I'm thinking, I don't even think about breathing and I'm breathing in and out.
Right.
But now, that's something that is a learned behavior.
Exactly.
So then, just like how I started the conversation, right? Because you taught me something, in a previous conversation that we had. You said that, okay, well, when your oral structure can affect your quality of life, and most importantly, is the air, is the air that you take in. So just talk a little bit more about that and why that's why people feel tired. I want to make sure that I'm clear.
Exactly.
Yep.
Yeah. So if you think about it, foundation of living is for you to be able to breathe. You can go days without food, you can go days without water, but you can only go minutes without breathing. And so our body is designed in, that way, where we're going to maintain breathing as long as, right, and in whatever way it is possible. And so the problem is that when we have a structural implication as the baby is born, the function is going to develop around it. So we look at it from a point of the structure is going to dictate function, but as the baby and the child grows and develops, the function then is going to dictate the structure, how the structure continues to grow and develop. So then we're looking at high narrow pellets, compressed airway, and all these other structural implications that are going to inhibit our ability to breathe. And especially is important when we breathe during sleep. When we look at breathing, obviously we need to be able to breathe during the day to function, but breathing during sleep is the most important aspect, because sleep is such a kind of area when we don't talk about it, and people's like, oh yeah, we snore, or we only get this much of sleep, or I need to have my coffee in the morning, otherwise I can't function. But that shouldn't be the case. We should be able to go to sleep and get the restorative effects from sleep. And when we can't breathe when we sleep, none of that happens. And so overnight, our body is constantly fighting to keep us alive. And whether it is through like waking us up, extending the neck, rolling us over, making us go to the bathroom, whatever kind of the case may be with somebody's like sleeping problem or the breathing problem that affects the sleep, your body's going to create that because number one function of your brain is to keep you alive.
Well, I need to look at sleep in a totally different way. I don't know if you guys know anything about this. I didn't. So I didn't know. So we learned something new today, right? So tell me okay, so if I am a person at home and I feel like totally normal, so how would I know what would trigger me to come and see a professional like you?
So most of the time, people would come and try to kind of see what the problem is once they start become aware that they have something that is persistent. And a lot of times, women are going to be more open to that, right? Women in general are more in tune with their bodies, so they're going to try to kind of listen to the symptoms and the signs and kind of what the body's telling them. But majority of the times is going to be the fatigue, the running just dependent on coffee and sugar and different, stimulants throughout the day to just stay awake. Other things that I see is TMJ problems, especially kind of.
What is TMJ?
So your temporomandibular joint, which connects the upper jaw to the lower jaw, and it allows you to open and close your mouth.
Okay.
So,
Okay.
so that's the joint, like your joint in your elbow or in your knee.
Yep.
So you have it right here by the ear. And so people would start having pain, and especially women are more aware and in tune of that. There's a facial nerve that runs really close to that. So there's some compression on that TMJ joint. Women will tend to have pain and discomfort versus men typically will have some clicking, popping. But men, it's just like whatever, just kind of typical things. So they don't pay attention to it until it becomes a problem.
You mean when they do the neck and it pop? Is that what?
And no, when you open and close your mouth, your joint will literally pop and make a sound.
Got you. Okay,
Yes.
I've seen they do that sometimes.
Yeah, and some people will actually have a locked jaw, so when they open their mouth and they can't close it back.
Oh, okay.
And that's very, very painful, and you have to pretty much go to the emergency room to have that resolved. But at that point, you know that your joint is under so much stress that there's either surgery and surgery for me is the very last thing.
So
that
what
you
do we
wanna
do to prevent that?
It's all muscle function.
Yeah.
So if you can work on how your muscles are functioning, you can stabilize the joint and therefore help reduce the pain, reduce the tension, and all the kind of symptoms and the clicking, the popping, all those things that come with it. But other than that, I also have adult patients that come to see us because they've been in orthodontic treatment as teenagers and they had braces again in their 20s and now they're in their 30s and they're looking into possibly having braces again because their teeth are shifting and they're back to open bite or whatever kind of malocclusion with their dentition. And after having one set of braces, two set of braces, then some people start to kind of think about like, okay, why is this happening? And the problem is that majority of orthodontists practice in a traditional way, what we like to call it, meaning that their primary focus is on straightening your teeth, regardless of what it's going to cost you. Meaning like if we put braces on your teeth, if that's going to result in your TMJ being more compressed and giving you some issues with that, they don't really care about that. And I don't want to say like everybody's like that, but that's kind of how the orthodontists are trained. Their focus is straight teeth. That's it, right? And so they're not looking at why does somebody have crooked teeth or why does somebody relapse from their treatment. And the truth is that anybody who needs any kind of orthodontic work, if we have crooked teeth, crowded teeth, any malocclusions, is because of their myofunctional disorder. So their muscles of the face, the tongue, the lips, the jaw are not functioning properly, and the person is compensating when they breathe, chew and swallow, and then when they speak, and then over time that creates those problems, such as orthodontic relapse, or when we look at kids that have kind of crowded mouths and crooked teeth, and not enough room for all their adult teeth to come in. It's all because that function wasn't there to support the growth of the jaw so that the jaw can accommodate all of 32 teeth. We're meant to have 32 teeth, not 28 or 26. In my case, I had teeth removed when I was little because, I had all these issues. And so here I am, 40 years later dealing with all that and addressing that problem.
Yeah.
So